So, you're at home and suddenly one arm feels weak. You try to lift it, but it only comes part of the way up. Or maybe you catch yourself in the mirror and notice your face suddenly looks lopsided. Or you're on the phone and someone says your speech sounds slurred or confused. You know what you want to say, but the words just won't come out properly. Hi, I'm Dr. Amayo, a GP in the UK, and I'm going to talk you through what typically happens from the moment stroke symptoms begin to the moment treatment starts. The first thing to understand is this. A timer has just started because every minute during some strokes, around 1.9 million brain cells can die, and what we're losing is function, the ability to speak, to walk, to move independently, and there's a short window of time where doctors may be able to limit the damage or even reverse part of what's happening. So, somebody calls for help. 999 emergency, which service? The call handler starts asking questions immediately. Is the patient breathing? Is the patient awake? Tell me exactly what's happened. They're trained to recognize the signs of a stroke, and if your symptoms suggest one, you'll usually be categorized as a Category 2 emergency call in the UK. There's only one category above that. So, now the ambulance team is moving quickly because that clock is still ticking. When paramedics arrive, they'll assess you rapidly. They'll examine your speech, strength, coordination, observations, blood sugar, because sometimes low blood sugar can mimic stroke symptoms. But if they strongly suspect a stroke, they'll usually blue light you to the nearest hospital with a stroke team, while pre-alerting the emergency department that you're coming. So while you're on the way to the hospital, the team inside is already preparing. Stroke call, 15 minutes. And suddenly, a whole group of people are moving much faster. You're in the back of the ambulance, lights and sirens are going off, you might be frightened, you might be confused, you might not fully understand what's happening, but it's okay because the people around you do. When you arrive, you'll usually be taken straight to resus, that's the highest priority area in A&E. Nurses are taking bloods, someone's attaching monitors, a doctor is rapidly assessing your strength, your speech and coordination, and another doctor may already be preparing your brain scan because now doctors need to answer one critical question as quickly as possible. Is this stroke caused by a clot or a bleed in the brain? Because the treatments are completely different. If it's caused by a clot, some patients may be eligible for clot-busting medication, but there's only a relatively short window where it may help. And in some cases, specialists may even physically remove the clot using a procedure called the thrombectomy. After that, the focus shifts towards recovery, monitoring, rehabilitation, physiotherapy, speech therapy, and trying to reduce the risk of it happening again. The best outcomes often start with someone calling for help early, before they're completely sure. So, if something feels wrong, don't wait, call.